The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Pregnancy is generally a 280-day period, which can be divided into trimesters. The first trimester is weeks 1 through 14, the second trimester is weeks 15 through 28, and the third trimester is weeks 29 up to 42 weeks. The first trimester can be very overwhelming. Many women experience symptoms like nausea, vomiting, breast tenderness, moodiness in the first trimester. That's all related to the hormones of pregnancy. In the first trimester, you can expect to have visits about every 4 weeks. The first prenatal appointment is very important. It helps us develop your due date and age your pregnancy. In establishing your due date, we usually use your last menstrual period, but if you have irregular periods, we can use ultrasound sometimes to help us. It's real important that we evaluate and establish your health and how your health can affect the developing baby. Of course, we encourage all pregnant ladies not to smoke, drink, or use any drugs. We also get lab work in the first prenatal visit and establish a continued plan of care. The second trimester, like I said, is weeks 15 through 28. In the second trimester, often pregnant women explain that to be the most enjoyable part of their pregnancy. For the first part, they look pregnant, which is nice, and they're starting to feel the baby move. In the second trimester, again, we'll see you about every 3 weeks and then progress to every 2-week visits. Again, we'll assess maternal weight, vital signs, assess the viability of the baby with the baby's heartbeat, and fetal growth. During the second trimester, we offer screening tests for developmental conditions such as neural tube defects. We offer screening blood work for genetic and chromosomal abnormalities such as Down syndrome. We also will assess the fetal organs by an anatomy scan. We can tell you the sex of your baby if you want. We also check for gestational diabetes with a glucola test in the second trimester. The third trimester are weeks 29 up to 42 weeks. The third trimester is, again, a very exciting time. You can kind of see the light at the end of the tunnel, know the prize you're about to have with the birth of your newborn. In the third trimester, we can expect to have visits every 2 weeks, progressing to every 1 week at term. In the third trimester, we offer screening for a bacteria called group beta strep that can affect the health of the newborn. We give antibiotics in labor if you have that bacteria. We also encourage pregnant women in the third trimester to take part in some of UT's activities such as touring labor and delivery, infant CPR classes, infant breastfeeding classes, and labor classes.
We hope you'll join us for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.